A change in ownership is taking place at the Claremore Indian Hospital, and there's been a lot of chatter online surrounding the Cherokee Nation's takeover of the facility, including potential job cuts and reduction of services. Fox 23's Devin Lyon joins us live from Claremore. Devin, you spoke with the Cherokee Nation to try and address some of these concerns.
That's right, Morgan. This change has been in the works for almost a full year now. The Cherokee Nation says it's a powerful step in the right direction for their healthcare system. Meanwhile, as you said, there's a lot of people raising questions and concerns about what services could be potentially cut and what are they doing about the hundreds of employees at this hospital. I spoke with the head of Cherokee Health Systems today to try to get you some of those answers.
The assumption of this facility and this healthcare facility and program will unite our healthcare along our whole reservation, and we're very excited about that.
Dr. Stephen Jones is the Cherokee Nation Health Systems CEO. The tribe is expected to take over the Claremore Indian Hospital by this coming October. The current building is nearly 50 years old. Cherokee leadership says they plan to build a new outpatient and emergency room building to replace the old one. Services will still be available while the construction is ongoing.
The federal government has not been able to uphold its obligation to American Indian and Alaskan Natives. They are way behind as far as funding goes to keep the facilities running and provide the services.
The change in ownership comes with some concerns. It will end services such as inpatient care, overnight stays. The tribe says that service averaged only 3 patients a day. Services such as pediatrics, ER, prenatal, and others will continue. But what about employees who currently work there, not employed by the Cherokee Nation? An employee at the hospital sent me this message. They wanted to remain anonymous. This was one of their concerns. Quote, "Something that is bothering most of the staff I've spoken with is that we have been told is the Cherokee Nation is cutting 100% of the staff and closing roughly half of the hospital. It will essentially be 100% of the current IHS staff applying for roughly half of the current positions." End quote. So I brought these concerns to Dr. Jones.
There are going to be a number of job openings according to our staffing. Right now, I believe there's around 370, 380 jobs are people that are currently employed by Claremore Indian Hospital, and we anticipate around 375 to 380 jobs being available for the outpatient and ER services. I can't say that it's going to be a one-to-one, every single job is going to be available, but we are planning on trying to keep as many people employed as we possibly can.
Currently, tribal patients here have to navigate the Indian Health System and the Cherokee Health System. Dr. Jones says this takeover streamlines care under one provider.
We deal with the patients that deal with having to navigate 2 health systems. So to unite this health system under one Cherokee Nation Health Services and to be able to provide the level of care and the level of services that we are accustomed to, that we expect of ourselves, and bring it to this community is very exciting. To be able to break down those barriers and open up access to care like it's never been open before.
Investment for this building is a proposed $250 million. Dr. Jones told me in the meantime, the tribe is working on contracts and partnerships with other clinics to still provide those inpatient overnight services at other clinics in this area. Now, we covered a lot of your questions in this interview, more than what I could fit into this story. But if you want to see the full interview for yourself and have more questions answered, you can find a link to it for our YouTube page on this story on fox23.com. Live in Claremore, covering news that matters. Devin Lyon, Fox 23 News.
Thank you, Devin. Before the tribe can use the money to build the new facility, it needs to be approved by the Cherokee Rules Committee. That's planned to happen on June 26th, just 2 weeks away.